afternoon and welcome to the podium. Our quote for today says, "Every mother deserves safe care, support and dignity throughout pregnancy and childbirth." Coming up in this edition of the podium, Princess Christian Maternity Hospital records 22% drop in maternal deaths in 2025. As government launches 2025 Open Budget Survey Report, we examine what the document reveals about transparency, accountability, and public spending. And we speak to the Freetown City Council on the enforcement of solid and liquid waste management and measures being taken to improve sanitation across the city. Well, all these and more lined up in this edition of the podium. Be part of the program. Send your messages to the number on your screen, 030-073-719, or you leave a comment for us on our Facebook page, slbc.sl. This is the podium. My name is Daphne Zainab Kamara. Welcome to the podium. First on the program this afternoon, government in partnership with the International Budget Partnership, Budget Advocacy Network, and other key stakeholders have launched the 2025 Budget Survey Report, which highlights progress in public participation and oversight in the national budgeting process, while calling for stronger and sustained budget transparency. Stakeholders at the launch refer to the process as encouraging but fragile. For more on the survey report, I have in the studio Abubakar Tawali, who is the policy analyst of Budget Advocacy Network. Good afternoon, sir. Welcome to the podium.
Thanks for having me, Zainab.
So now, before we come to the report, I just want to know why people refer to the process as encouraging but fragile.
So, if you look at the indices of the Open Budget Survey, for a country to be considered as producing or publishing sufficient budget information, it must score 60 and above in the Open Budget score. And so, with the index score, there are 109 indicators, of which we only, on the average, we score 50, and that is a decrease by 5% when you compare to the 2023 score, which was 55. And the decrease is not a good signal, because how can you reach 55 and you come back to 50? Even though 50 is an average score, but you cannot keep going up and down. So that is why it is said it is a fragile progress, because we have to sustain the scores from 55 to maybe now 60 or above.
Okay, so now let's talk about the process. What is the 2025 Budget Survey Report all about?
So it's about assessing three main aspects of the budget. The index score, which is transparency, looks at the timely production of critical public financial management information that should be published on time. And then it also assesses citizens' participation in the budget, and then oversight. And for oversight, you have two institutions: the Supreme Audit Institution, which in this case, the Audit Service alone, and Parliament. So when you look at it, the 2025 survey actually recorded progress in terms of citizens' participation and oversight compared to 2023. Because 2023 it was citizen participation in the budget was 20 upon 100, and the 2025 it is 30 upon 100. And for oversight, it is 50 upon 100 compared to 2023 when it was 45 upon 100. So this is progress. But then for transparency, we dropped by 5%. So why the survey choose to assess this critical element? The aspect of openness in the budget is key because the citizens should be able to know what is in the budget in terms of the budget estimate and the actual, and to see how government is also responding to the fair use of state resources. So, but if you have critical documents that they are not producing on time, like the in-year reports, and the year-end reports is not comprehensive enough and it does not contain certain elements like debts, figures, and of course the revenue, actual revenue figures and expenditure. It leaves out so much to be desired, because how can you now do a comprehensive analysis without this critical data? And for citizen participation, when you look at the matrix, the budget formulation stage scores the highest, because that is when every human being takes part in the process. But when it comes now to the enactment of the budget, very few people participate. And even when you participate, you don't have a speaking right in parliament because you are not an MP. You can only speak through your MP. And when it comes to execution of the budget, the citizens do not have the opportunity to also be able to monitor the budget, because now you need certain documents you need to analyze that will give you maybe the leverage to be able to follow the up-to-date nature. Like when you go to the fiscal reports for every month, they tell you what's the revenue and what's the expenditure. So for the first 3 months, you have a report from the Auditor General telling you how the first quarter is performing. And so because you do not have this comprehensive data coming into time, budget execution becomes a problem. So you need now to be able to get this information from the government, or a tracker that should give you real-time information whenever you need that, or the reports are comprehensive enough to tell you the story. But the citizens do not have this opportunity to participate. And of course, when it comes to the audit service will now do consultation, wider consultation with citizens as regarding which issues should be audited and how are they going. But the citizens do not have the power to testify, especially during performance audits. Okay, so that power that is lacking in these 2 stages of the budget execution, and of course the monitoring stage, maybe the audit stage, it's what marks down citizens' participation. Even though Sierra Leone is above the regional average for sub-Saharan Africa, and of course we top our regional peers, Ghana 22, Nigeria 24, the Gambia. But then it is not enough to say we can boast of such a score when we actually are supposed to score 60. We only managed to score 30.
And now, Abubakar, the theme, accountability at the crossroads, safeguarding budget, transparency, child-centered spending in Sierra Leone. Let's talk about how, especially child spending, that resonates with what's really happening in Sierra Leone.
Okay, so when you look at the broader picture, a deficit budget, often it tells you that the government does not have enough resources to spend. And when that is the case, they choose to rationalize. And rationalization means you prioritize your spending. And so because we have a lot of children needs that needs to be taken care of, education, health, and all of these things, if you have now to rationalize a budget which is not sufficient, it means a critical element of society might go without the funds needed. And so we are looking at the crossroad and saying, this is the 21st century. The budgets must be able to work for us. And so we started a campaign years ago when we said for equitable distribution of resources, the budget has to be gender responsive. So that's how the component of gender budgeting came about. Now they have piloted, there is now a gender budget statement, they have piloted it. But what happened to critical segment of the population, the children? Is the budget child friendly? No. Are they catering to the needs of children enough in the budget? We need to find the evidence from a subsequent analysis. But then it is to say that we have to have enough resources in there. How can we have a soaring debt, an increase in debt percentage that always consume what the budget should have done for us, including children, and when these resources are being used to repay debts? And so because of the percentage of debt repayment is almost consuming the entire budget, there is 0 or maybe a 1% fiscal space left to ensure development. So this development now is strangulated because it is not sufficient enough and there is little concessional funding from development partners. So we use the Open Budget Survey report to couch that thing, to see to it that we have a responsibility for the budget to work for us, especially people, the marginalized and vulnerable categories, to also benefit from the budget. So that's how we came about this local thing of the open budget.
Okay, thank you so much. Continue to stay with us because we'll come back to you as experts to offer solutions on safeguarding accountability and transparency. He is policy analyst of the Budget Advocacy Network, Abubakar Tawali. For another issue this afternoon, the Princess Christian Maternity Hospital has recorded a significant decline in maternal mortality last year, with death falling from 84 cases in 2024 to 64 in 2025, a 22% reduction. The figures were contained in the hospital's annual report. The PCM hospital is the country's largest and foremost public maternal facility. And for this, we have the Deputy Chief Medical Officer, Clinical, Dr. Mustafa Kaba. Good afternoon, sir.
Good afternoon.
Welcome to the podium.
Thanks for having me.
Okay, sir. Now, these numbers, before we come to in-depth analysis on them, would you say they are encouraging?
They are very encouraging because this is what we want to see. We, as a Ministry of Health, our priority is to ensure that no woman dies by delivering or no child goes to the hospital and dies of an ailment which I think we have the capability of managing. So we are very happy and thrilled to see this positive trend, and it's also in line with the 300 days of activism which we launched. So some of these high volume facilities are the places where we are concentrating most of our efforts, and we are starting to see good outcomes.
So, like you mentioned, the 300 days, are these numbers as a result of that, the mechanisms in place to cut down maternal and infant mortality?
Yeah, they are partly. The report is an annual report, and the 300 days is part of the year. So what we've done the past 100 days has really injected some new energy and some new spirit into the health workforce, into the professionalism, and also the availability of supplies and facilities, so that at least we can be able to manage some of these issues which can lead to preventable maternal deaths.
Okay, so now let's come to the numbers. 84 cases in 2024, 64 in 2025, and 22%. How did you get all of these? We know they are registered, but let's just have an analysis of them.
For us, even the figures we are quoting are still high.
Okay.
We are still not happy. We are only restful when we have a situation where no woman dies, when the figures are 0 from preventable deaths, right? Then we'll be okay. 66 and 64 are still high figures for one facility, and so it's a concern. So we keep doubling our efforts. But what we've seen is that we have been able to identify some of the key causes of these deaths.
Okay.
And one of them is, one of the leading causes postpartum hemorrhage, meaning when the woman goes to deliver, they bleed after delivery. So we have been able to put in place certain systems to ensure that this reduces. One of them is to bring in a specialized drug which we call heat stable carbetocin. It is like oxytocin, maybe you've heard of it, that leads to the contraction of the uterus, to expel the placenta after delivery. But if that drug is not potent enough, it will not be able to cause the contraction necessary to prevent the uterus from being in a lax state and bleeding. So this drug now we have is the most potent form of this drug available in the world because it is heat stable, meaning you don't need a refrigeration system to cool it and keep it. You can keep it in normal cabinets, normal cupboards, and they will still be potent and viable. And when we started using it at PCMH, we've seen more than a 40% drop in postpartum hemorrhage alone. So if you are tackling the leading cause and you are making such an impact, that's why we're seeing some of these figures we're seeing.
All right, so now coming to what is being done differently, counting the number of days, it was 300, now you've gone to 100?
100, over 100.
Over 100 days. Let's talk about the methods you use. Now you've explained one of them, the others.
Well, the others for this, to be specific for PCMH, you to get everything right, you need good governance. You need to have good administrators, good people there who will work at the local level to solve the problems. We're not going to solve the problems at Ministry of Health you build. The issues arising there should have a strong governance system. So the governance system has been reviewed, and we have a strong team there to monitor what's going on, to monitor the attitude and the disciplinary actions that needs to go with people not complying, and also to ensure that the stock level is always known. We know what we have, we know where our gaps are, and we try to get more drugs and commodities when available. And this place is also a training center for training medical doctors, training people who want to specialize in becoming gynecologists, training nurses, midwives. So what we've done is to ensure that we give them the devices they need, also to make right diagnosis, sophisticated tools like a state-of-the-art ultrasound device. We have now at that facility an ultra-modern state-of-the-art ultrasound device that is able to visualize the facial features of a child in the womb of the mother.
Wow.
So this is possible now at that facility.
Okay.
So if they're able to see that, other pathologies that are abnormal, definitely you'll be able to pick them. So these devices we've deployed in those centers are really helping, especially to pick out in the antenatal clinic when the women are not yet delivered, to understand this pregnancy you have now, it's a high-risk pregnancy, and it requires for you to be admitted 2 weeks before delivery. So we're going to take you out from the family, we're going to admit you and keep you calm until you deliver safely. This pregnancy you have is a high-risk pregnancy. You cannot deliver in a small facility. You have to deliver in a place where everything is available. So before it becomes an emergency and we start moving you now from that facility we cannot manage it. So we put you in a place where you're already settled.
Yeah.
We are ready for whatever consequences. So I think these are some of the things we've been able to do with that facility at PCMH. Of course, we've renovated the operation theater. They have access now to cesarean section capabilities. We have now 3 theaters running. So simultaneously operations can go on in a clean and sterile space which has the equipment for the job to be done. And we have the high dependency units also, which we upgraded with QAM support also, and the outpatient. So a lot of infrastructural upgrade, a lot of equipment support, training, improving on the capabilities, as well as commodity management has gone into what we're doing to see the results we're getting. at that facility.
And now, talking about commodities, let's talk about how the modalities in place to monitor, because most times, like that drug you mentioned, normally it would be expensive for like a patient to buy. You know, how do you monitor that these are given on the spot, on time, not being the patients not being hassled to pay amounts, exorbitant amounts, and being in a life and death position?
Well, this is one of the things which we are really monitoring during these 300 days. You know, maternal care is free in this country, and the law has not changed.
Okay.
So, to the best of our knowledge as a ministry, and we tell our staff it's free. So, we encourage the public to help support us, to give us information whether they are not receiving the services free, with tangible information in place where it occurred. Then we can take necessary action. We know that there are people out there who are causing issues, but we are really trying to make sure that this stops. Such drugs are bought by governments because you already mentioned it's so expensive. It's stable capital to say, but the outcome of investing in your people is so huge to the point that it is worth the investment that governments are doing in making sure that these drugs are available for the people. And it's not only about the rich who can afford it, but these are drugs that are available in the public hospitals. I'm sure if you go now to the private hospitals, you will not find this kit stable capital. If they are even getting it, it's possible that they are getting from our own supply chain system.
Yeah.
But we at the Ministry of Health and the government is the only entity that procure these drugs for this country.
Okay.
And we see the impact it's creating. Managing the stock, we have digital tools which we are using now. We have the M-Supply. We need to scale that so that at least it can house the coverage, and it can be diverse in its terms of outreach. Now it's just the Podium district and some few other districts, including Western area. But we need to make sure that it goes all over the country. We are using where you can see at facility level your commodities you have, what is nearing expiry date, the supplies you received, and the potential threats of stock out will be clearly highlighted using this app.
Okay, so now let's go to the infants. What is being done differently to prevent the deaths for them? Not just when they're being given birth to, after and care.
Well, for us, we always look at what is causing the death. We always take it from that point. Why are the children dying? And then you target your interventions at the causes. You know, you have a system and you see just this group of people still dying. What is causing their death? So we've analyzed and we've seen that malaria, pneumonia, diarrheal diseases are some of the leading causes of death in our 5. So our interventions are targeted towards ensuring that we have adequate malaria commodities by testing the babies. We are making sure that one important thing which is also important for viewers to know, which I must say, is that the nutritional status of the child is very important. So this comes from the community, what the children are fed, how you do breastfeeding for 6 months, compulsory, and what kind of nutritional products are you using for your kid, so that this child is not malnourished. The minute the child starts going to the level of being malnourished, there's so many risks of other diseases coming and overwhelming the child. For example, like pneumonia, it's chest infections, right? They can have it. They are susceptible to other bacterial infections that are all over the place, which normally their immune system will be able to fight. But because of the malnourished state they are in, they are not able, and if they are having these diseases, they really go down very bad. That when they come to the hospitals, you have to not only fight the disease, but you have to take care of their nutrition also and bring them up to speed. So that is one key thing I think we are trying to do during these 300 days. And thirdly, the public engagement, especially for kids. These kids, they cannot tell us how they feel usually. When they are sick, even you have to ask them, how you feel, how your body, before they tell you. But adults, you can go, you can express yourself, and you can seek care. But a kid is highly dependent on the caretaker, meaning the father, the mother, or whosoever. So the caretakers have to be very observant and direct this kid or take them to the right facility on time. If you start trying herbal medications, or you go to a small pharmacist and take drugs, and the child has severe problems, including anemia and blood or shot, or you begin convulse, you get fits now, the body warmth, now that's in the counter now. Sometimes it could be late. And we've noticed that a lot in most of the patients that come to our facilities, that people come too late. Come a bit early and we can do something and help. So our engagement with the public at that level is really intense, and this is what we are doing during this 300 days campaign also.
Okay, so continue to stay with us. He is the Deputy Chief Medical Officer, Clinical Dr. Mustafa Kaba. Well, the program you're watching is a Podium, coming to you live on SABC Television in Freetown. We go for a short break. When we return, we continue with the conversations. The program you're watching is a Podium, coming to you live on SABC Television in Freetown. Be reminded that you can be part of the show. Send your messages to the number on your screen, or you leave a comment for us on our Facebook page, sabc.sl. But still with me in the studio is Abubakar Tawali, the policy analyst of Budget Advocacy Network. Now, Abubakar, as we are discussing the 2025 budget survey report, let's talk about solutions, as an expert, because we know your institution has a wealth of knowledge in this area. Let's talk about solutions you would proffer, starting with transparency.
So for transparency, which is index score, we recommend that the in-year budget is produced and published within a stipulated timeline as stated in the Public Financial Management Act 2016. Because the media report is critical to telling the government whether they are staying put within the initial macro fiscal forecasts, or things might change either upward or downwards. But if it is not produced, then we see the supplementary budget coming in. It leaves so many accountability and transparency questions, in the dark. Because at the end of the day, the essence of the macro fiscal forecast is for the revenue authority or the tax authorities to be able to know what is expected to be in the resource envelope. And based upon that assumption, the budget is prepared. But if these assumptions are not met, then the media report should be able to communicate that, so that we know if the supplementary budget is coming in, it is being done based on realistic assumptions. But even with the budgets, there are times when figures are given, and at the end, the actual amount that are disbursed do not match the allocation, the initial allocations. This will give heed to budget credibility issues, because it tells you that what you initially had allocated to a certain institution, they did not receive it, and you should be honest enough to say that, so that the public could not expect much. And of course, they should also be comprehensive enough in the year-end reports, because there are assumptions in the beginning, but then in the end, these assumptions might change. It's either they increase the user's envelope in the course of the year as a result of greater turnout in tax payment or non-tax revenue, maybe even a grant, or you receive less. So the year-end reports should be able to explain that. And again, the comprehensiveness in terms of the budget when it comes to debt. The debt, the revenue figures, because at the end of the day, you will think that the government is on course, but there are challenges inhibiting this progress. So that is why the open budget is always calling for openness in its entirety, such that you can be able to inform what will be the bottlenecks, the possible bottlenecks that may cause some of these targets not to be met. Okay, and again we are saying that the government should also try to ensure that the parliament performs its function, its oversight functions properly. There is a time when the PFM allocated that the budget proposal should be in parliament at least 6 months before its enactment. That period has been reduced as sorry.
It's a very long time. 6 months.
Sorry, 6 weeks. Not 6 months, 6 weeks.
Okay.
I said 6 months.
Okay.
6 weeks before it is enacted.
Okay.
So that MPs will have the time to go through these documents and able to debate before enacting. But we see that this period has been shortened, and so the moment the budget proposal is taken to parliament, is being rushed. And so there is no way to look at it from a gender lens, from a development lens, from other things. So we are saying that it should go by the original provisions in the PFM Act, which says 6 weeks before it is enacted, it should be taken there. And then the fiscal strategy statement, which is the pre-budget. This fiscal strategy statement should be comprehensive enough, because in this case, the fiscal strategy statement is actually containing the assumption macroeconomic outlook of the economy. So in that FSS, there are initial assumptions about how the economy might perform within the fiscal year. And so if it is comprehensive enough to say these and these will constitute the revenue, and this is going to be the expenditure, and we keep tracking from the fiscal report January, in March with the projection, February, March with the projection, March with it March. So we know that going forward, our macro fiscal forecast is credible enough. Otherwise, we don't need to stay within a faulty macro fiscal forecast when it is telling you it is A, at the end of the day it is B. So when you have all of these variables together, you put a sound macroeconomic outlook that the country will rely on. Those of us that are analyzing the budget will be able to do so religiously, keeping the government on a track that you committed to this and this, but you are falling short of A, B, C, D, E, F. So because the moment you improve the domestic revenue, you also improve your development program costs, because this is where you take to finance all of these developments. And so these are the solutions, so to speak, we can profile to the government. They need to look at this, how to make this document comprehensive, timely publication, and ensure that the parliament performs its oversight functions. Because when you look at the scores, audit service scores 78%, but then parliament score is around 28%. So no matter how high is the Supreme Audit Institution rating, because the oversight function of the legislature is low, overall they end up to score 50. You understand, in the 2025 overall assessment of oversight. So we need to be scoring 60 and above to see to it that our country is providing enough oversight.
Okay.
With the advent of, or maybe the resurgence of the parliamentary public committee, where they are now looking into the Auditor General's report and providing a solution, we are also recommending that the new PFM Act makes a timeline provision, because often this report comes too late.
Okay.
When we look at the 2021 and 2022 Auditor General's reports, the report came out in March of 2024. And so maybe there might be remedial actions, or maybe go after some of the unresolved recommendations that might improve domestic revenue. But when the time has now elapsed and there is another fiscal year, it requires the effort of people following up on some of these recommendations, in other words. And again, the internal audit department at the Ministry of Finance should be able to produce a compliance report on the standard operating procedure, the SOPs, because the SOPs were actually established to see to it that state entities comply with the Auditor General's recommendations. Most of the time when you see processes and procedures are not followed, it actually leads to loss of resources and people not having the required services that they might want. So the moment the internal audit begins to produce a report on compliance and it has a cabinet backing, it means that the government will be taking some level of actions, punitive measures, to see to it that public servants actually take the Auditor General's report seriously by, of course, actualizing or implementing the recommendations that are contained in their year in and year out reports that are coming in with almost most of the time the same recommendations, because the issues are not resolved.
And now, does the timeliness of the disbursement of funds affect the budget?
Yes, it's one of the major budget credibility issues that we are having.
Okay.
Because it leads to rollover events in the budget. Say first quarter we are to receive a certain quota. It is not until the last quarter that these monies are coming in. And so what you think you should be doing in the first and second quarter might wait until the third quarter of the year. So it affects the development program, and we're also saying that that's why we should try to have a credible budget system, such that when the budget is done and the fiscal year starts, these transfers should go ASAP, so that these ministries, departments, and agencies can be able to go and do their work, rather than having to wait for some months before the money comes in, or they have to incur debts most of the time to ensure that timely delivery is done. And there used to be a department at the Ministry of Finance called the Research and Delivery Unit, which actually goes to see how many deliverables are accomplished by MDs,
okay,
such that they will tell in real time how the budget is being executed, where the resources are going, and the impact of these resources.
okay.
But it has taken some time now. This department is not producing a report on the budget execution, or maybe the delivery of the deliverables in the budget.
Okay.
This should be done so that it will keep us on check to see in reality what are the MDAs doing where, and who is benefiting, who is not benefiting, so that actions can be taken to ensure where there are lapses or where there is lack of resources, and it is also leading to a lot of people not having the required services to have, so that the government's program development agenda goes side by side with the resources that is available.
All right, so thank you so much. Continue to stay with us, Abubakar Tawali from Budget Advocacy Network. And also still with me is Dr. Mustafa Kaba, Deputy Chief Medical Officer, Clinical. Now, Doctor, this report is for PCM Hospital. Let's talk about the impact of the 300 days countrywide.
Well, the impact has been phenomenal. It has really Even anywhere you go now in this country, people talk about it, especially in our health facilities. I think we've been able to achieve that, to create the level of awareness that people need to understand what we want to achieve. And we have been able to achieve a strong national governance system at the national level. All the leadership, the ministers, everybody's aligned, and there's a strong effort and alignment on ensuring that the activities which we put forward are implemented at the district level. We've also been able to achieve a strong district ownership, meaning the districts themselves have organized themselves through, of course, our leadership, with specific groups, task force, and implementing entities who are doing this work. We have been able to achieve to create a national coordinating unit that goes around and coordinates between these institutions, these different bodies, to ensure that things are done adequately. We have also been able to have a series of engagements with community stakeholders. We had a very, very successful meeting with all the paramount chiefs in this country. That was one of the best meetings I've ever had in this country. We have people come, the paramount chiefs, to express themselves at their community level, what they want, how they want this campaign to be done. We gave them what we have as a plan, and before we left the meeting, you know what happened? They committed themselves to adopting bylaws in their communities to ensure that every pregnant woman goes to deliver in a health facility. So no home deliveries. Every child that is delivered in a district, in a hospital or wherever should be vaccinated. So if you see what we've achieved, our vaccination drive is one of the best. We know we have the 300. From the 3 zeros, the vaccination drive has been the most successful because we've achieved more than 50% of our target. We have about close to 9,000 people, children in this country who are not vaccinated. So we vaccinated over 5,000. So we are close to it. We've reduced maternal mortality by 30% in these 100 days. We've reduced in-child mortality by 11% in these 100 days. So it shows that with all of what we're doing and the figures we are getting, we are on the right trajectory. A lot more needs to be done. Like I mentioned earlier, every single life matters, and it's important that we do our best to save them.
Okay, so with this methodology in place for the 300 days, let's talk about lessons learned.
Well, lessons learned in such a campaign, there's a lot of coordination that needs to take place. A lot of actors have to be involved. And in starting it, it's always the discussion to get people to come to the table to discuss, to get people to share their ideas, to get people to 100% own it. But we're able to achieve it because at some point in time, this is not about me, it's not about you, it's a national effort. It's about the lives of our kids, it's about the lives of our women, our children, our sisters, our daughters. So people are willing to support, but it all requires a lot of planning and bringing people together. Can be in the initial stages a challenge, but once people come on board and work on it, we have things done properly.
So moving on, let's talk about how you would increase what is already in place to achieve 100% results for the 300 days for now.
Yes, for us now we have less than 200 days.
Okay.
Our main focus is now to really be in the field. We have set all of these governance structures, we've set the structures that needs to run the system, and we have the acceptance of the public, and we have the cooperation of people, including our partners and donors who are supporting. Now the next phase is really to be on the field and implement all of what we said we want to do, right? We want to make sure that every experience a pregnant woman has with our health facility is a pleasant one.
Okay, so quoting Abubakar just now, and what next after the 300 days?
What next after 300 days? We want to see more improvement, especially around the health outcomes. You know, we always use maternal care as the entry point to improve and elevate the entire health sector. By doing by improving on the maternal care, you're improving on the general services in the hospital. So we hope that during these 300 days, we'll inject a new sense of responsibility and accountability, first of all, in terms of what we do in our health facilities. Everybody should be held accountable for their actions. If I'm a nurse, I should do what I'm supposed to do, and I should be held accountable if something goes wrong under my watch and I'm responsible. If I'm a doctor, I should do what I'm supposed to do correctly according to what my scope of work is, right? If I'm a midwife. So if everybody takes their responsibility individually, just that bit of it, we'll come a long way and we'll go along. And if that continues after the campaign, it's a big success for us, and we are sure it's going to continue.
Okay.
Because we are not only doing it for people to see the health outcomes, we are also using it to tag capacity building, who needs to be promoted, who's doing well, who needs to be posted somewhere where I think you can do better. The best district that did well this past few months has even received some support. The first 5 districts, we've announced them, and we're going to give them some support. So people are looking forward to these kind of things and making sure that they do more. But after the 300 days, it's going to be sustained through the strong foundation we are setting now.
So are there additional helplines to report for even emergencies or any anomalies?
Well, we have our usual 117 for all emergencies in the country. We can call there, and then the call center now will divert you whether it's a referral system you need, or if it's something you need services around reproductive and child health, or some mental health services. I think that's the call line we use now, and we'll encourage people to continue using it if they need help.
Okay, thank you very much. Now, Abubakar, finally, you are encouraging public participation, but sometimes is it advisable, because we know that input from the public can be sometimes ambiguous?
Well, I would not say it is ambiguous. That is why over time we have what we used to call pre-budget engagements. This is to guide number of people we categorize as marginalized and vulnerable group to be able to channel their burning needs such that they will fit into the budget.
Okay.
Because the government has the big 5 game changer.
Okay.
And so whatever you want to see the government do in the budget, it has to align with government's program, the government priorities. So your need must fall within the health sector, it must fall within the education sector, within the agriculture, within all of these intervention areas. So what we do is to take them through the medium-term national development plan during the workshop, and based on that we do needs assessments, and then we prioritize this need to align them to the sustainable development goals. And so what they do now is to document these needs and do a follow-up at the respective MDAs.
Okay.
So if these are health needs, they themselves will take their burning needs to the Ministry of Health and do a presentation that Ministry of Health, whilst you do your budget this year, this is our burning needs. We want you to include them in the budget.
Okay.
And so for education, and so for the aged, social welfare, there was a time when people with HIV positive, they had a burning needs because I think UNDP was pulling off some support and they needed the government to come in, and they had these antiretroviral drugs that they needed so bad for their sustenance. They went into the ministry and presented their burning needs.
Okay.
And the ministry actually incorporated their burning needs, and it was part of the budget for that year. So this approach is done in the sense that the budget officers might not be able to know
To capture all
what is the respective needs of people that might require budgetary support. But when they come forward and bring their needs, I think that is an encouraging platform. And again, the question of feedback with Ministry of Finance, the budget bill, often the MDs, CSOs like us will be part of the budget discussion, and we will document the process and see provide solutions where we think they can improve more. But often when these reports go, they don't give feedback. So when we had the open budget survey launched this time, the acting director of budget took a commitment that to begin to see how much he can do to give feedback, timely feedback, because it matters a lot. Because if we see that the citizens' budget needs are not captured, you can have an opportunity to go through the enactment stage, parliament.
Okay.
You lobby your parliamentarians to see if there is a gap in the budget and they see that there is enough reason for these needs to be incorporated in the budget. They can actually send the budget back to the Minister of Finance and tell them incorporate these things.
All right.
Because the budget should work for the people.
Okay.
Because without them, of course, the budget is not people's responsive budget. So we should be able to see people's needs and body needs captured in the budget, and then the budget now works for them.
Okay, well, thank you so much. That's how we end the podium for this afternoon. Many thanks to my studio guests, Dr. Mustafa Kaba and Abubakar Tarawali. The program was produced by Joseph Stanley. Our quote for today says, every mother deserves safe care, support, and dignity throughout pregnancy and childbirth. My name is Daphne Zainab Kamal. The podium returns tomorrow, same time. Have a blessed day. Goodbye.